Thank you. It's really an honor to be here today. And I never forget that Monica was my first supervisor way back when, years ago in Toronto, and has been a mentor for me, particularly around immunization, for a long time. I'd like to start off today by acknowledging that we're here on the traditional and unceded territories of the Squamish, Musqueam, and Tsleil-Waututh peoples here in Vancouver, and it's just wonderful to see some faces in front of me and to say hello and greetings. And I'm very grateful to be able to work on these lands, and I think a lot about how we have come through and what we have learned from the traditional keepers of these lands. I just wanted to take a minute this morning to talk about our immunization journey, and I was reflecting of being here, and I was here to give the opening address 2 years ago when this all started, and we were talking about this new phenomenon that was happening. And I think about it, the work that I've done over many years working in pandemic planning, and we had a session about pandemic influenza planning and we were talking about all of those things that we would have to do had we needed to manage a pandemic. And who knew then all of the things that we have been through in this past 2 years together? Who knew then that we would all know exactly what an ultra low temperature freezer is, and how to get one, and how to use it, and what a pizza box is, and to be able to describe mRNA vaccines to people in language that they understood? Who even knew about mRNA vaccines? Who knew about viral vector vaccines, about the fact that we would have a safety system that allowed us to pick up very rare side effects like VIT? Who knew that we would have, we'd be able to talk about baculovirus and moth cells, and the development of plant-based virus-like particles in tobacco plants? These are all the things that we have been through together. We have a new language together. And we think about, in 1 year, we've delivered in British Columbia, you've delivered in British Columbia, over 11 million doses of COVID vaccines alone. And that is phenomenal. If we think about all of the questions and the concerns and the anxiety and the fears and the unknowns that we have come through together in this past 2 years, and the fact that we've been able to protect so many people in our province and across the country. When you think back about planning, and I naively think about, oh, well, mass vaccination clinics, and we had this kind of plan that was part of our Canadian pandemic influenza plan, and we had the annex about mass vaccination clinics. And think back about that now, and what we've learned in this last year of having mass vaccination clinics, how many people it takes to run those clinics, how all of the logistics and the operations that needs to come together to be able to put, as we did down the road here, 6,000 people a day through a clinic, and do it safely and have every one of their questions answered. How we have taken vaccine to every corner of British Columbia, and I still get emotional, which I am now, thinking about that float plane landing in that First Nations community. We think about Hartley Bay, we think about Ahousaht, where we were able to bring vaccine to people in winter and protect particularly our seniors and elders at that time who were most at risk. How we went to every single long-term care home and provided vaccine first to those who are most at risk. And I think we have to recognize as well over the last 2 years, but the last year of our vaccine program, the importance of all of those pieces that connected us. Things like the fact that we had an immunization registry, and we were able to put every single dose and lot number and arm of which vaccine people got into that registry. And that was so critical when you have brand new vaccines that we didn't know much about, and we were giving them to millions of people. And that allowed us to ensure the safety, and we could say they were safe because we were watching for it and we were looking at what was happening, and we could find by lot number exactly who got what. And, initially people were like, oh, well, we'll remember what vaccine we have, but we know they don't. We know we don't. Even when it's a seminal event like your first Pfizer vaccine, and people don't remember once you get more and more vaccines. And now we have 6 vaccines approved for use, 5 of which we're using here in British Columbia and in Canada, and the critical importance of being able to know exactly who got what when. And we've had the framework of the BC Immunization Committee. We've had the Vaccine Evaluation Centre, and I know you're going to be hearing from many vaccine voices, from Manesh and from others. And we had the researchers and the background to be able to make those critical decisions in real time when we needed to rapidly assess whether the vaccines were working, whether it was reasonable to extend the interval between dose 1 and dose 2, particularly when we had a lack of supply. And some of those important, critical decisions that we made together have made a huge difference in saving lives in this province and in this country. The fact that we increased the interval between dose 1 and dose 2 meant that we could protect more people sooner, and that saved lives. The fact that we stuck with the 6 months and we're able to have the vaccine effectiveness data to support that means that we have people with stronger, longer lasting protection after their booster dose. The fact that we had the data that allowed us to say that mixing and matching vaccines not only was safe, but it actually provided added protection for some people, particularly those people who had viral vector vaccines. The fact that we had the relationships that allowed us to connect with people like Deb Money and her team so that we could understand the effects of COVID on people who were pregnant and the effects of vaccination and the importance of vaccination in protecting people who are pregnant and their children. The massive infrastructure that we put on top of our basic programs, and I think of the public health programs that we've been running and trying to do immunization, where we're giving millions of doses of influenza immunization every year, and we had to scale that up in such a short period of time with new vaccines and new immunizers. And it is amazing to me the fact that we were able to use pharmacists and pharmacy assistants, firefighters, doctors, nurses, retired doctors and nurses, naturopaths, chiropractors. People supported this because they knew how important it was. And you were the backbone that allowed us to do that. The nurses and doctors that have been working in our immunization programs for so long was the reason that we were able to scale up and bring in all those other immunizers and do it in a way that met the needs of people on the ground and was safe and worked. And I think of all the joy and the happiness that we saw on people's faces when they came into vaccination clinics and got that protection. And I've been to clinics around the province, and just that feeling of relief and hope that our vaccine clinics gave. And it is the reason that we have been able to weather this many faceted storm that we have been through together, and recognizing, as I've said many times, that we're all in the same global storm, but we're not all in the same boat. And it is a testament to every single one of the immunizers that we have across this province that we've been able to meet people's needs. And we have vaccination rates that are some of the highest in the world. And we have protected our elders and seniors. We've protected everybody across this province because of the work that you've done. We've looked at the most vulnerable, even when it wasn't particularly welcomed. We've protected our truckers. We protected our temporary farm workers, and we're able to provide them vaccine as they came into the province to make sure that they were safe when they were providing those essential services in our farms. We protected the workers in our food processing plants, recognizing how essential their work. We've recognized more about our connectedness and how important it is to have our grocery store workers and our pharmacy workers and our food processing workers and people who carry the food to us. And we've protected people in very unique situations, people in corrections, where we were able to provide them with the protection that allowed them to live and to be respectful. And we now have new tools that we're learning, and We also know that as we get through this phase, our transition phase, we're going to get back to some of the other important immunization programs, and I know that's going to be part of what we're talking about later today. But let me finish with this. Vaccines are a silver bullet, and they have made all the difference in getting us through this storm. They are the definitive tool that will continue to keep us safe. There will be more uncertainty. We will have waning immunity. We will have new variants of this virus. This virus is not going away, at least for a time. And we will keep learning, and we'll keep adjusting, and we'll keep looking at how we can best use these silver bullets to help us get through what comes next. And I want to finish by saying thank you to everybody who's on the line here, who everybody's been part of this amazing and really critical program over this last year. What you have done is truly heroic, and you have made all of the difference, and you've done it with grace, with caring, with kindness, and with compassion. Thank you.